Hello, everybody. In our session of podcast, in order to improve the quality of life of patients with liver diseases, we have today Adi Klein-Horowitz. She is 43, married, mother of three, and she's a doctor of traditional Chinese medicine.
חוליו, אני
Her father,
שואלת אותך, סליחה, יש בעיה משפטית בלהגיד דוקטור, כי אין לי דוקטורט, ולכן זה משהו שחשוב מאוד שלא יהיה, אז זה בסדר. אז אפשר לומר, she is a specialist of traditional Chinese medicine, she's a practitioner of traditional Chinese medicine, expert, her field of expertise is the liver disease.
Okay.
אבל דוקטור אסור, זה לא קביל.
Sorry, doctor. Sorry, professor. Okay. Hello, everybody. In our session of podcast, in order to improve the quality of life of liver patients, we have today the pleasure that we have with us Adi Klein-Horowitz, married, mother of three, and she's expertise in traditional Chinese medicine. Her father was diagnosed with hepatitis C in 1993, and she sparked her father was diagnosed of hepatitis C in 1993. She sparked her quest to find the best cure for him. Adi graduated with highest honors from Tel Aviv campus Broshim in 2008. Her journey then took her to China, where she spent a profound year at Chengdu University of Traditional Chinese Medicine. During that time, at the university hospital, she specializes in several departments: liver, gallbladder, digestive system diseases, and diabetes. There, she learned that combining Western medicine with traditional Chinese medicine can provide the best patient outcomes. Since returning to Israel in 2009, she has provided treatments for various liver diseases: fatty liver, metabolic syndrome, diabetes, obesity, cardiovascular disease, and complex patients with autoimmune diseases. Since 2010, she joined HEADS, the Israeli Organization for the Liver Health, as a board member and has been collaborating with HEADS ever since. She is teaching traditional Chinese medicine since 2012. Now, Adi, let's start with a general question. What is the connection between China's medicine and liver and liver disease?
Thank you, Julio, also for that introduction. Well, traditional Chinese medicine has a very long history of treating liver disease. We can actually find ancient texts dating back to around 100 BC or even before that, which describes various types of liver diseases. Of course, in that time, the terminology was very different, so we can find references like Huangdan, which means in Chinese, it means a yellow gallbladder. Or we can find references to Xietong, which means pain in the ribs, and so on. And each one of these conditions were described with all of the symptoms and what the patient presents, ways of treatment. The ways of treatment had acupuncture protocols and herbal substances that until today we research them and see how they affect the patients. We also have the differential diagnosis for these situations in the ancient text. As the years gone by and the dynasties move on, we gathered more and more information and more practice in treating liver diseases. So the knowledge was gathered. Today, we combine modern research that shows that traditional Chinese medicine can be very effective in treating liver disease. researchers identified various herbs compounds that can help regulate the lipid metabolism, reduce inflammation, and improve the liver function. So these references highlight this very long-standing tradition of using traditional Chinese medicine to address the liver health and ongoing efforts that we still have these days to integrate it into modern medical practices.
Who are the people that come to you for a treatment? Which kind of patients are coming to you?
Well, I treat in my clinic many types of patients with chronic disease. If we regard the liver section, you can find a wide variety. I see people with fatty liver disease, with autoimmune liver disease such as AIH or PSC or PBC. I used to treat more viral hepatitis, but since we find a cure, or since the medicine found a cure for hepatitis C, mainly now I will treat people with hepatitis B or patients with hepatitis C that wants to keep regulating their body and try to prevent the damage that was caused to the liver by long-term sickness of hepatitis C. Even after they healed from the virus, we can still find damage to the liver. So we can try to prevent hepatocell carcinoma from developing or cirrhosis. I also see people with cirrhosis due to various reasons. I can treat people that are on their way to a liver transplant and try to build a bridge for them of safe passage until they will find the liver. And I treat people after having liver transplant and help them recover and maintain a better life quality.
Adi, I understand that there are different methods of treatment, not only needles. Can you tell us about, in general, what different treatments have?
Yeah, I can say that when a person comes to my clinic, I can diagnose him from several points of view and use several types of methods, which I try to custom to this person. So first, when someone comes to the clinic, we will review all of the medical history. I ask them to come with the files from both from the hospital and medical history and blood works and hospital discharge summaries and his current medicine. So we build up the whole Western medicine point of view of what's going on with these patients. And sometimes I'll ask him to complete some more exams. I will send him back to the doctor and ask him to do some more. And then we'll discuss his lifestyle habits like diet and his mood and any symptoms that may bother him. And then after that, I can conduct a physical examination that we check in the traditional Chinese medicine. We look at the person and the way he walks and the way he talks and the way he brings himself and the color of his flesh and how much his skin sparks or not and how much he addresses you properly. And we take all of this under consideration. We examine the tongue, I examine the abdomen, we take pulse diagnosis, and then when we have a very rich, comprehensive assessment, both of his Western medicine point of view and the Chinese way of assessing patients, I compile a bigger picture of what's going on with this patient. And then I can choose, regarding your question, how I will treat him. Some patients will benefit from acupuncture alone, and some patients require also herbal medicine that will help them greatly. Some of the patients, while they rest with needles, I can work physically on working on their neck and stiff shoulders or other kinds of pain with traditional Chinese massage. It's called tuina. I always go over the lifestyle of the patient and I see what kind of habits he has that can harm his liver or support his liver, and I try to teach him how to live better lifestyle for his disease or for his condition. And we also address the nutrition, whether we add a little bit of, or that I will send someone to a specialist that specializes in nutrition for liver patients.
Now I have comes to me a question regarding to the herbs that China's medicine is giving. Are they validated for safety and efficacy like normal medications?
I'm very, very happy that you asked it. And it kind of throws me to what is a safe treatment, okay? So it is very, very important in Chinese medicine, and also when I teach my students, is prima non nocere, first do no harm. And it's especially important when we deal with people that already has a problem with the liver and the way that the liver can break down chemicals or other supplements. So it is very important to take herbs from a well-certified practitioner who knows exactly which herbs can be combined to what situation. I'll give you an example. Usually, most PSC patients, but not all of them, don't the response to herbs is not so good. I will usually prefer to treat them with acupuncture. Of course, there will be people I'll give herbs, but it's under the medical way of thinking for me. But for other liver patients, such as fatty liver disease or even with cirrhosis, herbs can be very, very beneficial. I give my herbs from 2 companies in Israel that are very highly regulated. They have all of the regulation and approvals from our government and the Ministry of Health. And I think that all liver patients should be very careful about who they take their herbs from, both from the side of the practitioner and both from the side of the herbs themselves and who manufacture them and who sends them. So it's very, very important question. First, do no harm.
You said 2 things that catch my attention. Fatty liver and PSC. You know that today in fatty liver we have limited treatments and changing the style of life is one of the best challenges that we are not so much success in convince the people. This one was regarding to fatty liver. I wanted to ask you, what do you do? And regarding to PSC and also PBC, we heard a lot complaints about itching. How Chinese medicine can help with the fatty liver and itching?
Okay, I'll separate the answers for both questions. Okay, so with fatty liver disease, we can differentiate between NFLD, a non-alcoholic fatty liver disease, or the ALD, which is the alcoholic liver disease that also creates a lot of buildup of fat in the liver tissues. And we can also look at the further more dangerous form of it, the NASH, the non-alcoholic steatosis, which means the steatohepatitis, which means that we already have inflammation in our liver. Now, the common grounds for most of these situations is that eventually the inflammation will create liver damage and can lead to cirrhosis. So in Chinese medicine, we have many ways to address the fatty liver disease. Okay, first of all, we can regulate lipid metabolism with Chinese herbs and with acupuncture. This is a very, very important way of helping a person. Now, we said you have trouble convincing people to change their lifestyle. But when I combine Chinese medicine, it's easier for people to make changes. I'll give you an example. I'm also a member of Acupuncturists Without Borders, and we treat people who've undergone trauma, emotional traumas or things like that. And we use ear acupuncture to help regulate the nervous system.
Wow.
So it is within our ability to help people relax and be more and make changes in their life in an easier way. The traditional Chinese medicine consider the liver from emotional perspective to be the organ who can control our life decisions, where I want to go, how I want to achieve my goals. And when we address the liver function with acupuncture and herbs, it's easier for me to achieve my goals. It becomes easier for me to make life changes and to eat better. So I can combine ear acupuncture that is also being used as a protocol to withdraw and can help with to withdraw from alcohol or from bad eating disorders. So we actually can address the problem in many, many ways. But I can also tell you that the fatty liver disease is almost always curable with traditional Chinese medicine.
Wow.
Our herbs are very powerful in that. This is one of the easiest, actually. I think that PSC can provide me much more of a challenge than fatty liver disease. With fatty liver disease, if the patient will follow my lead and will take my herbs, he will usually recover.
Wow, it's new for us and very, very interesting. And what about itching?
The itching, we have a lot of ways to help that. I think if we'll explain for 1 minute the methods and the way that we treat people, maybe it will be a bit easier to understand how we address the itching. If it's okay with you?
Yes.
So I want to broaden your question, not just for itching, but how do we help liver patients at all? Not just the fatty liver disease, which is fairly easy to treat, or the more complicated situations like PSC, which is very complicated to manage, or other autoimmune diseases, or hepatic cell carcinoma, which is more of a challenge to manage. So if we look from the Chinese point of view of how we address the liver patient, our main goal within the treatment is to we divide it to few sections, and then when we combine these sections together, we can get a comprehensive way of treating these patients. So our main goal will be to reduce the inflammation. It's fair to say that Chinese medicine can reduce inflammation. We also have researches to support it in many ways, both with herbal medicine and with acupuncture. We also have the ability to improve the liver texture. We have herbs that help to regulate the blood flow in and out of the liver, and by doing that, we can also decrease inflammation, but we can also bring more nutrients for the liver cells to recover better. It is a well-known fact that a tissue that has a good blood supply is not suffering from stress. So we have the ability to do that. Furthermore, we can maintain liver function and protect the cells from poisoning and from other substances that may be harmful. So in that way, we try to address the main issue of stopping the disease from deteriorating, or trying even to get the liver to feel better. We achieve this with acupuncture, with herbs, with life guidance, with all of this, but it's tailored to the person. Like I said before, I will not give everything to everyone. But in addition, the other thing that is very important to address as a traditional medicine, or as someone who comes to help the Western medicine and not replace it, but to work alongside, is that we have a very good ability to address a patient's quality of life. And this is where the itch comes in, okay? So in in traditional Chinese medicine, we have many, many ways to help people cope with sleeping disorders or pain or upper coordinate pain or mood disorders or sleep disturbances, or being very, very feeling sick and tired. And also if a patient comes with a bad backache, it's very important to help this patient with his quality of life and to get rid of these symptoms. So if we combine all of this together, sometimes we can even help the Western medicine to reduce the amount of medicine that this person needs to take. Because if we regulated the inflammation faster, then the doctor can withdraw from steroids faster, or will need less of the steroids in that perspective. But I will never do it myself. We will always work with blood works, and I always go work with the doctor that says when and where and how much. It's very important to work hand in hand. So we offer a very comprehensive and very personalized approach to our patient. I'll give you an example. It's very different to treat someone, like I said before, with fatty liver disease or with an autoimmune disease. Or even if I look at liver inflammation and I will try to integrate herbs that reduce the inflammation, there will be a very big difference whether this inflammation was caused by hepatitis C or B virus, and then I want to really enhance the power of the immune system to work and kill the virus. Or if I want to reduce the inflammation but moderate the immune system while doing so because we have an autoimmune disease in the background. So it's very personalized, and you need to be very well aware of where and what you choose for your patients. And another very important thing is that we look at the whole person. For example, a person with fatty liver disease will, a lot of the times, will suffer from very poor nutrition. He will eat not properly, and a lot of the times he will be diagnosed with the whole metabolic syndrome. He can have high blood lipids, and he can have insulin resistance, and he can be at a great risk for heart disease. So it's very important not to look only at his liver, but choose the proper way to treat all of that together, the insulin resistance and the lipids and the nutrition and everything. And if we look at someone with an autoimmune disease, a lot of the times they will come with other autoimmune diseases like IBD. And if this person cannot absorb very important nutrients from his food, then we have a problem, and his liver disease will get worse because he's getting weaker. And we need to address the whole person as a whole and not just his liver condition. And this is, I think, one of the strengths of integrated medicine, that we can look at the bigger picture and not just at the liver function. So we actually tailor our patients' individual treatment. We consider their emotional state, their general health. We look at their age, and also we will treat sometimes differently men from a woman. We look at different lifestyles, and everyone comes very different from another. One will come with PSC and is not sleeping well, and the other comes with PSC and is itching very much. So we actually tailor our treatment to see what we can do. And also we're very dynamic because inflammation comes and goes. It's very common for autoimmune disease that the inflammation rises and lowers, and it has its waves in a natural way. So it's very important for us to be able to follow the disease and see at some points we'll choose more in a treatment, we'll choose more to reduce inflammation. In another treatment, we'll choose to address the symptoms or the itch. And in another treatment, we'll say, for now, the inflammation is fairly under control and we don't have so many symptoms. So we can actually go and try to improve the liver function and to use some tonifying methods, okay? So if I go back to your main question about the itch, after explaining all of that, I can now say that we have many mechanisms that we can help itch. Okay, so first, we have studies that show two very important things. First, that acupuncture can regulate endorphin levels and can make your brain secrete endorphins and help you by that reduce the feeling of the itch and be able to cope with it better. The second thing that acupuncture can do for you in that sensation is to modulate the nervous system, and then we can modulate the feeling of pain in the body. So if we modulate the feeling of pain, the itch suddenly it doesn't take that much of your day or of your brain or of your feeling. So we can reduce the related itching sensation by regulating the nervous system and the signaling pathways that regard itch. Another very important way is what I said before about improving the blood flow of the liver. And by doing that, we can try to address the root cause of that itch, which is the sickness of the liver, and try to get it to feel better so we will not have that much of bile that accumulates. And a very, very interesting thing for me, I think for the best about itching, is that there are Chinese medicines and substances that can actually regulate bile acid metabolism. We have herbs or acupuncture that can increase the flow of the bile from the liver to the duodenum, and then we can reduce by that the excessive accumulation of the bile acids or other toxic compounds in the liver and the gallbladder. And another way, we can also enhance another substance that was actually researched and was shown the pathway of in its biomedical way of working, is to enhance the excretion of the bile acids, both from the serum in the blood and from the liver to the intestines, and that way out of the body through the feces. And so we can combine a lot of methods to help a person cope with itch, both from the root cause of trying to get the liver and gallbladder to function better and to get rid of the excess bile acids, and both by regulating the nervous system and trying to reduce the pain and the itchiness feeling from the brain point of view. So
we have, for example, Alagille syndrome in kids that they are suffering a lot from itching. All of the things I understand that can be applicable in kids.
Of course, we use the same methods with kids. Of course, kids are not small grown-ups. We need to understand the metabolism, and the way that the little body works is different from grown-ups. But we can apply some of the substances and we can apply some of the methods. Not all kids will want acupuncture, and sometimes I will only use herbs, and sometimes with kids I only use twina to help them relax and soothe and feel better because they're too afraid of the needles. So like we said, we have many, many ways to integrate with liver disease, whether they're old or young or sebum. I will not give very harsh substances to small children. So it's also very important to know what you give each and every one in a different way to suit him.
And another thing that we deal for people with advanced liver disease is hepatic encephalopathy. Please tell us something about this.
This is very saddening. You can see very, very intelligent people with great life background who becomes confused, and it's a great burden both for their families and for themselves. It's very hard to deal with. Also, we can see mood changes a lot with liver patients, and I think that acupuncture is very helpful both in regulating mood disorders, because we will not separate the liver function with metabolism and with manufacture of of the proteins in the body and all of that, but we cannot separate from the Chinese perspective that the liver is also responsible for the smooth flow of emotions in the body. So when we get people with a liver disease, a lot of the time we'll see with the liver, when the liver function deteriorates, we can see the confusion and we can see a lot of anger arises, and people can say, I don't recognize him, this is not my husband. I don't know what happened to my husband, I don't know what happened to my wife. But when you regulate the liver function, you can also get improvement in the mental health. And like I said before about the bile excretion, if we help the liver to get rid of toxins, then we can help reduce the encephalopathy.
Okay. So you can reduce the quantity of toxins of the liver that the liver is filtering.
Yeah, we can try. It's not always, you can't always do everything, okay? It's also considered about how much the patient is sick. Sometimes people can be very, very sick, and all you can do is offer your finest support to reduce pain and to help them on their way. But a lot of the times the liver is very tolerable, and we can actually restore liver functions because it's a great organ. It can resolve himself.
Adi, are there risks in treatment of Chinese medicine?
Yes, I think for everything there is a risk. So first of all, I will say that the most important thing is always to get your treatment from someone who has a very good training. You can't go just to anyone who had a course of traditional Chinese medicine. I'll give you an example. Here in Israel, proper Chinese medicine takes 4 years to study, and then it's like you're a 4-year-old kid. You learned how to control your body, and you know how to walk and eat, and you sleep well at night, but you still need to learn a lot more about life. So I explain that to my students. When you learn for 4 years, you have the good basic understanding of a very new language, but you still need to accumulate a lot of flight hours and to study more. So I think when Chinese medicine is practiced by someone who has proper training, is very safe. We can see that it's very safe. Our needles are sterile, and they have they're all approved by the FDA. Well, of course, we use them. In my clinic or with my students, I will never ever let anyone use there are kind of needles in China which are reusable. We don't have them here. We never use reusable, always one use and straight to the bin for the medical trash bin. So Chinese medicine is very safe when used properly, and is very often combined and integrated with the Western medicine when we can enhance the overall treatment effectiveness, because we look at the patient, and complex patient requires a whole lot of frames around him to help him. We need a liver specialist to give the medicine, but we also need maybe a physiotherapist to help him, or maybe a social worker if he has problem regarding in his life because of the disease, or maybe he can use a good emotional support from a psychologist. And also I think that traditional Chinese medicine can get in that frame in a very, very good way. So if we look at safety, when it's used properly, and you have a practitioner who knows when to use only acupuncture, or when you can also use or when you have to use Chinese herbs or herbal medicines, and you know how to combine with Western medicine, it is very safe. And I always work with periodic blood works and see that we're actually making progress and not harming the patient. So it's very important when you have a liver disease, if you take substances and supplements or anything like that, you can undergo periodic blood works and see that your liver is actually getting better and not getting worse. So from that perspective, I can say that we have a lot of medical centers today around the world that provide traditional Chinese medicine as a service within the hospital. So when it's done properly, it's very safe.
And regarding to the studies, are new studies with the scientific validity for the safety and efficacy of new treatments regarding to Chinese medicine? Because we are used to see studies in normal medicine that has all the steps of efficacy, safety, and all these herbs are also passing all these steps.
Yeah, a lot of them. So I said at first that it's very important to see the regulation in your country and see that within your country you go to a certified practitioner that meets your country's criteria to who is a certified practitioner, and that he orders the herbs from a place that was well supervised. Regarding researches, I can tell you that we actually, traditional Chinese medicine has actually got a Nobel Prize. There is a researcher, I'll find the name. Toyoyo, I think, I'll look it up, that actually won a Nobel Prize. She's not a practitioner, but she won a Nobel Prize for from taking a compound from a well-known traditional Chinese herb, and she made it a cure for malaria. And now, because of her, we have cure for malaria. But it was made of a Chinese herb. And also there is an Israeli work that was done here in Shiva Hospital that combined mesalamine with curcumin that was extracted from Chinese herb, and they showed better outcomes in treating IBD patients than just taking the mesalamine alone. So there are many researches that show the benefits of traditional Chinese medicine. It is a bit hard to research Chinese medicine. I can agree with that, because if I tell you that every time the patients come in, I will tailor his own suit, it's very difficult to take one compound and examine it, because I always make changes. If I always make changes, it's a bit hard, but this is why it's important to work with the blood works and with the ultrasound and with the a common sense and a good logical sense of when do we stop and say, no, I'm sorry, I can't help you. I see that you're not improving. Or say, wow, we have great improvement in so many factors, both in the liver inflammation or the liver tissue, or we had gallstones and now we don't have them with the ultrasound. So it's important to see a good progress.
So I understand that if sometimes someone needs antibiotic, you will tell him, now you need antibiotic.
Of course.
Now you go to your GP and ask him a receipt for traditional normal medicine. So there is no, my last question was if there is a risk in combining Chinese medicine treatment with Western drug therapy.
Well, again, I will say that when you go to a trained specialist, he will know which medicine can go with which herb and when to stop using herbs and only go with acupuncture or trina or life changes or things like that, or when it's safe to combine the herbs. I can tell you that for complex people with heart disease, they take a very long cascade of drugs. They take something for the blood pressure and another medicine for the blood lipids and another medicine for the diabetes and another. They take so many drugs. And then again, when I combine the herbs for them, we can see actually improvement in the ejection fraction and the way that the heart works, and the lipids and the blood works become better, and the lipids becomes lower. So we actually can work together with the medicines. The interesting thing about the hospital that I studied in China was that the hospital worked in a very inspiring way. All of the doctors there had MD. They were all MD doctors. And
Sorry.
so the interesting thing about the hospital that I worked in China, which was very inspiring for me, that all of the doctors there were MD doctors. And in addition, they were all treating of traditional Chinese medicine. So if you would go, back then there was no cure for hepatitis C. So if you go see and consult the liver doctor, his hands were quite tied. He would just follow you and say, but there was no drug to give you. So he would give you herbs. And when you went to see the diabetic doctor, which were all MD doctors, she would give you insulin or metformin or another drug that you needed with Chinese herbs together. And together we have better outcome. So it's important to know who is responsible for what. Like the doctor will be in charge of the steroids and reducing the inflammation and etc. And our herbs for the good and bad are less strong than Western medicine, but it's an advantage as well as a disadvantage. We will take the side of helping the drug to work better. And we can also help people tolerate the drug better. Sometimes people who take steroids suffer from a lot of things, from sleeping disorder or anxiety. So we can help them tolerate the steroids better. We actually help them take the medicines. It's very important.
Adi, in conclusion, what is your main message for our audience?
First, I would like to say thank you for having me and for listening to what I have to say. So, in conclusion, I think that Chinese medicine offers really significant advantages for treating liver patients. The combination of ancient methods with modern research creates a very broad and very safe knowledge base, and that allows us to make the body stronger and to restore liver function and improve the quality of life of patients. And furthermore, we can personalize each person for each patient, and we can view the patient as a whole and see not just his liver disease, but the entire thing that bothers him, like he's going through a very bad divorce right now. Okay, so we can deal with everything within the session, and so the treatment can improve the physical health and both the mental, emotional balance for our patients. And we can actually provide a very supportive framework alongside with the Western medicine to cope with a chronic illness. And that will be my main message.
Adi, thank you very much in the name of many people suffering for liver diseases and that are waiting to find ways to improve their quality of life. I always say that sometimes when we are coming to a liver doctor, we have the feeling that he is looking at the liver and he's forgetting that there is a human being around it. Now we hear totally the opposite, and for us is a big hope that all the things that you have been teaching us, and I hope it will help many people. And I want to thank you very, very, very much. And I want to remind the people that we have many things to learn in order to improve our quality of life. And I wish to everyone to be healthy. Thank you very much.
Amen, Julio. Thank you so much for having me.
No, thank you for your voluntary time, for all the time that you were preparing this for us. We appreciate this very, very much. Thank you very, very much to you, Adi. You gave us, for me, unless a lot of new things. Thank you.
Thank you so much.
Bye bye. Bye bye to everyone.
Bye bye.
Bye bye.